I'm Dr. Rosie Saxton. I'm a GP in Albury, Wodonga now, formerly a GP in rural area up in Walwa for 16 years, and I trained in England, so I came here in 1990. And I also work as a counsellor, and that's probably my main part of my work these days. And I also have a special slant, but I think that's on one of the next questions. So my approach to healthcare is a little bit different because I practice what's called mind-body medicine. Now this is not quite the same as integrative medicine, which is quite popular in the city, where doctors are involved in diet and nutrition and things like that, as well as conventional medicine. The way that I work is looking at how the emotions affect the way the body works. So emotions and beliefs, how they affect how our body operates. I have an enormous issue with the fact that it's described as an industry. We are a service, not an industry, and I think that is in fact one of the big problems, is it's being treated like an industry, and you can't look at productivity in terms of healthcare. What we should be looking at is well-being and health rather than illness. And what we tend to come at in the entire health service is coming at it from an injury or an illness perspective of preventing illness or stopping illness once it's happened. We need to be moving much more into a preventative area and looking at wellness rather than at stopping illness or healing illness. There are a number of issues that affect this area particularly, or regional areas. Obviously the access to healthcare is reduced compared to in the metropolitan areas. The number of healthcare personnel is reduced. The distances that people have to travel, both the healthcare personnel and the patients have to travel, is increased, so access is a difficulty. Then there are the specific issues of farming communities who are of course being affected by climate change, and I think that's one of the things that we as doctors need to be advocating more, and I know that within the profession there's a lot of talk now about the effects of climate change on health, and I think this is pretty huge in terms of farming, because the changes in the climate are affecting the way that farmers are experiencing life. There's a lot of emotional results from droughts and from all the other changes that are occurring. Healthcare issues in this area, I don't know that this is necessarily very different from metropolitan areas, but it's certainly very clear here is that the emotional health is a very major issue. There's a huge amount of depression, and we know from all of the world statistics that depression is expected to be one of the biggest healthcare issues in the future. And so emotional health is something that certainly I personally am involved in working with and focusing on a great deal, and I think that is being massively addressed at the moment, and that goes right down to children, so it's partly to do with our education system and our health system as well. So as far as the RDA collaborating, I think one of their focus is looking at multidisciplinary and networking and going across disciplines, and I think that's incredibly important. There is a lot of duplication of services, a lot of people trying to do the same thing and reinventing the wheel, and I think the Murray RDA could certainly help by helping to coordinate some of those diverse multidisciplinary areas so that they're working in a collaborative way to improve the local health, particularly emotional health. And I think what some of the areas that are most important is increasing community. One of the big things that is I feel is particularly missing these days, and this probably goes back to an earlier question about the rural areas, is that there's a real lack of community these days, and this is certainly seeing these in these very small villages around communities around Albury, Wodonga. And so the Murray RDA I think can do a lot to help build community, which then improves resilience and also improves emotional intelligence in those areas, so that people are more able to cope with the ups and downs of the economic times.